This is exactly how a code is run. Dr. Ron is at the head of the bed. Dr. Bruce is here for backup. They're asking for RSI meds on deck. What up? My name is Josel James, and welcome to another breakdown of St. Denis episode 5. I'm going to do a deep dive, a breakdown, things you missed, go scene by scene, and talk about this episode. If you like breakdowns like this, let me know. Subscribe for more content and like the video so I know to make more content. But first, did you watch this episode? What did you think of the episode? Let me know in the comments below. Let's get into it. The episode is called The Peanut and Caramel Filled Miracle. I don't know what that means, but we're going to find out. This episode opens hot. It opens up hot. Let's see. CPR scene. And this is exactly how it is. With a clock on the wall. But Matt gets called in. So then they have to push some epi. And these rooms look so real the way they're bagging. It just looks so real. I don't even know if I think I've said this before. I don't even know if I'm watching a show. But it's so real. And he's obviously the comedic relief in this, but the numbers on the screen make sense. They get pulses back. Matt's so happy. But it's not like that. Once you do get pulses back, it's kind of sad. But then what's going to happen to that patient? It's weird because part of you feels like Matt here. Part of you feels very happy that you saved a life. But at what cost? You broke some ribs. You don't know what the quality of life of this patient's going to be. And a lot of times the codes you do are on older people. Probably after their 60s or 70s. But I think the way Matt is acting is exactly how a lot of us feel sometimes. And there's a lot of comedy relief. Sometimes people crack a joke or two during codes. I like this scene. It's very accurate. Here's the intro. I like the intro. Dr. Bruce, the tool, Joyce's kick, St. Denis Medical. Here's a scene with Matt. And look at this room. There's an Alaris pump there. There's suction in the back, oxygen in the back, room 107. It looks so real, and that's what I love about this show. A lot of like the little tiny details that look so real. The bedside table, like that's a real bedside table. I know that sounds weird to get excited over, but bravo NBC. That looks like a Lynette bed, and here's Matt looking for the patient that he saved earlier. So Joyce here tells Alex to fire somebody, which is kind of messed up. I've never had to fire anyone. I've been fired before. Fun fact, but that's a story for another time. If you want to know those stories, I think I've been fired twice. If you all know that story, leave a comment below. I'll tell my stories of how I got fired twice, multiple times. I don't know. Got fired on travel assignment. That's another story. Anyways, moving on along. Here, Matt's looking for that patient he saved, and Matt's so naive. I miss feeling like that as a new grad. You're just full of energy. Oh, I saved a life. Let me go see what happened to them. Actually, I still do that in my later careers. Because you put so much work in a patient, then you want to find out, oh, whatever happened to that patient. Here, Val just kind of tells Matt, I don't care. Oh, we're just saying things. I thought we're just saying things that we don't care about. Val's so funny. Val, after this episode, Val's easily one of my favorite characters of the show. She just has such funny remarks. Val's obviously so jaded. Like, she doesn't care. She doesn't care that Matt just saved a life because she's probably been a nurse way over 10 years. And look at the details in the back. It's probably people's assignments. Man, this show is so cool. I'm glad to not be working in the ER anymore. There's a line here where this patient doesn't finish her antibiotics. That'll probably drive nurses crazy because you want to finish your antibiotics, right? That's like a common thing. People get prescribed antibiotics and they don't finish them and then they end up getting sicker. But also, I've been in that situation where I've been prescribed antibiotics and I feel like I just didn't need them. I didn't take them. Look at this scene in the back. Look at that. Someone is throwing linen away. How realistic is that? It's just so weird. I love how realistic this show is. Like, things that would happen in ER are actually happening. He's cleaning linen. That's wild. Dr. Ron's a weirdo. Talks about here how he loves that chocolate bar. A lot of this episode centers around these two guys, and it's like a feud between Dr. Ron and Dr. Bruce. And I like it. And I'm kind of wondering in the hospitals how doctors beef, because I'm sure doctors beef. I mean, I've seen it. But I like how the show portrays it here. Because these two are pretty polar opposites in personality. Dr. Bruce is just a tool. Dr. Ron's just kind of a little quirky. Also, is this just product placement being shoved in our faces? Is that what this is? Alex here is venting to Val how she has to fire Debbie. And Val just doesn't seem to care. Val says there's already another Debbie. Which, if you're watching this, there's probably a Debbie in your hospital. Because Debbie RN is such a common name. I think in every ER I've worked in, there's been a Debbie RN, which I don't know if this show knows that, but this show definitely knows that there's hella Debbies everywhere. Here, Matt is going to visit the guy he saved. And look, the guy he saved is already wearing a nasal cannula. And you can assume this all happens in the same shift, right? This all happens in the same shift, but this is just unrealistic. A guy that you just saved is not going to be sitting up with a nasal cannula within the next hour, just chilling like this, watching TV. I mean, in a perfect world, right? But you broke this guy's ribs. He was on hella meds. There's no way he's breathing on room air. But, Hollywood. But also, this guy's a total dick, which pretty accurate. The way all he cares about is just the TV when you're going in and asking him something. That's kind of accurate. A lot of patients just don't care. And this episode explores that. Matt just saved someone's life and he just wants to be thanked. And I definitely vibe with that. Sometimes I just want to be. We do so much for our patients. Sometimes they don't even give a thank you. And sometimes they're mean to you. You know what? I don't even mind if you're mean to me because you're going through a rough day. I don't mind if you don't say thank you. I don't look for thank you. But if you're rude or if you're being a dick to me, that's when I don't like you. It's kind of messed up. Like, there's no need to be an asshole. I don't know if I can say asshole. Can I say asshole? This is my show. I can do whatever I want. There's no need to be rude. There's no need to be mean. And some patients are just mean, especially when you're doing all these things for them. I don't expect them to bow down to me at all. I expect you to be, I don't know, not a dick. Here, Serena's just trying to get the doctor's attention so she can discharge her patients. Pretty accurate. A lot of times you just want to sneak that discharge so the doctor can sign off on your order or do that one thing. You just need that one thing done, and you need a doctor's signature. You need a doctor's sign off, and that's what Serena's trying to do here. So that's pretty accurate. Oh, Dr. Ron gives Serena the hand over a candy bar. This guy's so weird. He loves his candy bar. So pissed. Look at him. He wants a candy bar so bad. Dr. Bruce. Is this product placement? Is this a real bar? Nutrageous? Is Reese's Nutrageous? Now I want one. Is this whole episode just product placement for Nutrageous? Let's look it up. If this is all just product placement for Nutrageous, kind of annoying. Reese. It is. Reese's Nutrageous. It's a thing. I didn't know that. Thought it was just a made up thing for the show. I hate product placement. Reese's Nutrageous, if you're listening, hire me. And here, Dr. Bruce and Dr. Ron are just fighting over this Nutrageous bar. Oh, and there's a lot of penis jokes. What do they say? Get your nose off my bar. That's for sure a penis joke. Here, Alex is about to fire Debbie, but she doesn't have the heart to, and I wouldn't have the heart to. Firing someone would suck. See this? People love doing this. People love showing their pets in the hospital. And Alex like, yeah, I don't care. I need to fire you. Look at Serena here, still trying to get that signature. That's funny. Look at Serena looking at the camera. This is the way the characters look at the camera on this show is so funny. It's like that's like what we're all thinking. It's like, what are these two doing? And how she looks right here. This is exactly how you feel in the hospital sometimes because you're just trying to do your job, but there's so much chaos and other things going on. It's like, I don't care about all this drama that's going on. Just let me do my job. And her face perfectly captures that. This character, Keith, is so funny. Every time he's in his scenes is just funny. And look at this part. He just walks into someone. And honestly, sometimes that happens. You just turn around and there's so much hustle and bustle in the ER that you end up running into something or someone. And that happens to me quite a bit. Maybe I'm just clumsy. Dr. Ron here, still clearly not over it. And what is Serena doing here? Serena's doing some wound care, picking at stuff. Looks like a road rash. Maybe he was on a motorcycle. Public service announcement. Don't ride a motorcycle. I've seen too much in the ER and in the traumas. Don't ride a motorcycle. Also, clearly, the whiteboard in the back here, not updated. That's accurate. For those of you that don't know, there's this thing in the hospitals where you have to update your whiteboards and they will audit you. Of all the things that they audit in the hospital, they love auditing whiteboards. Are whiteboards helpful? Yes. But sometimes you're having a fire dumpster of a shift and all administration does walks by and asks for an updated whiteboard. And it just pisses you off, pisses me off. Like, leave me alone. You want to know about the whiteboard? I don't care about the damn whiteboard. I'm very passionate about this because I've had some very bad days where I'm drowning. I'm literally drowning in ER work, in emergency work, in taking care of patients. And all these administrators is like, don't forget to update your whiteboard. Whew, I needed to get that off my chest. Thank you. Here Matt's venting because he wants to thank you. He says he wants to be appreciated. And sometimes that's all we want, right? Sometimes that's all we want as nurses, as healthcare providers, appreciation. And a lot of people say, hey, we're not in it for the thanks. And I don't think a lot of us are, but you're breaking your back. A little bit of, I don't know. What do you all think? A little bit of gratitude? I don't know. It's just like you're breaking your back here and you're not getting anything back. You're not getting anything back from your patients. You're not getting anything back from administration. Sometimes you're not getting anything back from your coworkers. So it's kind of like, what am I doing here? I'm giving, and I'm not getting anything back. Yeah, I'm getting a paycheck, but is it worth it? Is this paycheck worth it to what I've been giving? And for me, it wasn't, right? That's why I left bedside nursing. I was giving, because every time you go to work, you're giving, not getting anything in return outside of the paycheck. Because if you start really thinking about it, it's like, what am I getting in return for the paycheck? What am I giving for the paycheck? It's kind of difficult confronting that, thinking, what am I doing this job for? Is it just the money? Because if it's just for the money, there's other professions out there. There's other things we can do for money if it's truly just for the money. And I think that's something we all ask ourselves. Next scene, Alex is saying that, no, Debbie's cool. And Joyce's like, all right, if she messes up, you messes up, and you take responsibility for all her mistakes. And Alex is like, oh, I don't want that. Next scene is Dr. Ron in the gift shop looking for his bars, but they're out. And so he finds one in this gift basket. And the gift shop guy saying it's $200. And he's like, are you kidding? I'm not paying $200 for that. Dr. Ron's so mad, and he says this line. What does he say? This is a hospital gift shop. Nothing that happens here matters. And that's kind of messed up. Hospital gift shops are important in every hospital. But then here's a scene with Alex and Debbie. And because of the conversation that Joyce and Alex had, Alex's control freak comes out. So Alex doesn't want to fire Debbie. But on the other hand, she also doesn't want to be responsible for her mistakes. The way they're talking here too, Alex was saying, hey, don't use the Tegaderm. It might tear the skin. You should use the Mepilex instead. That's word for word exactly what they would say in the hospital. Use the Mepilex instead of the Tegaderm because of the skin breakdown and how fragile skin can be, especially in geriatric population. That was pretty accurate. And I thought this was pretty funny here when Debbie says, just tell me what to do. I'm your puppet. And Alex is awkwardly laughing. Tiny details. And here's Matt back in our patient's room whose life he saved. And small detail, but he's on room air now. Earlier he was on nasal cannula. And again, patients don't recover that fast. You're in the ICU after you get intubated and we've done CPR on you. You are going to be in the hospital for a while. Definitely won't be up in bed like this at 45 degrees. Oh, here's an updated whiteboard. We're just talking about whiteboards. Here's an updated whiteboard. It says in the back, cardiac consult. You'll need a cardiac consult for sure after we did CPR on you. BW, I'm assuming for body weight. VSN, what's VSN? Vital signs, maybe neurochecks, monitor Q3. And I don't know what that says on the bottom. Surgery, PCT. Oh, wow. They even have the PCT on the board. See, this whiteboard is up to date. Oh, the floor whiteboards are up to date, but the ER whiteboards are not up to date. So this show is saying something. This show's talking trash on the ER. I don't know why I'm offended. I don't even work in the ER anymore. And then Matt gets into the gruesome details about the CPR, and the mom's just very horrified. CPR is not a pretty sight. When we do CPR, we break a lot of ribs. It's not a good sight. A lot of family wants to come back while we're doing CPR, and it can be very traumatic for family to see that. So we don't let anyone in unless we absolutely need to. So it's kind of sad too. Man, this show's making me sad. I love how the guy here is like, don't upset my mom. That was funny. Here, Dr. Ron is confronting Dr. Bruce about taking all the nutrageous bars from the gift shop. And Dr. Bruce is like, I don't know what you're talking about. And I thought this part was so funny. Dr. Bruce is like, I don't know what you're talking about. Why would I do something like that? To teach you a lesson? I literally laughed out loud. And he said, to show you that there are consequences to disrespecting a colleague. I thought that was so funny. Dr. Bruce is such a tool. It's so funny. Meanwhile, Joyce and Alex are over here role-playing, trying to get Alex to fire Debbie. But Joyce starts talking about these solar panels, leading Alex to be like, are we talking about you getting the solar panels? I thought that was funny. Next, we have this scene, and yet we still have this scene of Dr. Bruce in the OR. And this is a good misdirection right here. They turn on the radio, And what song do we all think is coming on? We think it's a callback to the first or second episode, I forget. And it's not the Beastie Boys. I think he's a fan of the Beastie Boys song that's supposed to come on, and he's going to start dancing. It's how he preps for his surgery, but it doesn't come on. It's Dr. Ron instead singing. It's kind of weird. These doctors are hella petty. Look, Dr. Bruce is horrified. Horrified that it's Dr. Ron singing. It's pretty accurate too, these scrubs. Look at Dr. Bruce trying to stop the music or Dr. Ron singing, but he's still trying to maintain sterile technique. I thought that was a funny touch. Here's a conversation between Matt, Val, and Serena, and they say, "You want gratitude? You're in the wrong business." And I feel like this show is talking to all of us. You want gratitude? You're in the wrong business. Matt has a huge crush on Serena. And what does she say here? She says, "Who cares what some random guy thinks? You saved his life." That's what we have to do sometimes. Like, who cares what people think? You worked hard to save their life. Because if you do it for the gratitude, if you're in this job for the external validation, you're not going to get the external validation. If you're really in this job just for people thanking you or for the praise. Remember we used to get applauded during COVID? People used to clap for us. And people say thank you for your service. People thank me more outside of the hospital than inside the hospital. I don't know why. Yeah, why is that? Like, oh, you do so much for us. But I hear that outside of the hospital. Inside of the hospital, I don't hear that. But whatever. I don't work in the hospital anymore. Serena gives Matt praise and he's so happy. And this is one of my favorite lines. Val says, "You smell that? It smells like boner in here." It's probably one of the funniest lines of the show. Here's Dr. Bruce and Dr. Ron making a truce. And they're talking about some secret stash of butt wipes. People actually do have secret stash of butt wipes in the hospital. I've seen them. I mean, I haven't seen them use it. I just seen the secret stash of butt wipes. I'm going to stop talking. Dr. Bruce takes all the nutrageous Reese's bars and puts them in a stool. I don't know if this was some other kind of joke, but it was kind of funny. I like how Dr. Ron is all upset about it. All upset that, "Can't believe you did this, but I'm taking this." I thought that was funny. So after all that buildup, Joyce is the one who still fires Debbie. And Debbie's just like, "All right." Thought that was funny because there's so much buildup to that moment. Alex was agonizing over the entire show during the duration of this entire shift of firing Debbie. And then Joyce just comes in and does it in 10 seconds. And it isn't even that big of a deal. Here's the climax of the episode coming up right here where Dr. Ron's trying to get his nutrageous bar. He loves these bars. But then Serena comes here and says, "Hey, I got a weak and thready pulse and low blood pressure," meaning someone's crashing. Oh, she actually says, "Someone's crashing. I need a doctor." The way she says this, the way she's saying, "He's crashing. I need a doctor." That's the same exact words that we would use in the hospital. So I thought that was really slick. Dr. Ron coming in. She grabs the crash cart. They have to intubate, and this part is hella realistic. Dr. Ron is at the head of the bed. Dr. Bruce is here for backup. They're asking for RSI meds on deck. This is exactly how a code is run. They ask for the gladyscope. He says he can't see the vocal cords because of the swelling, and he asked Dr. Bruce to take over. This happens exactly like that. Some doctors can't get the tube in, so they have to ask for other doctors' help, and the other doctors are very willing to help. So this part's super realistic, and everyone's running around. Everyone's running around like this. They even show the monitor, and it's very realistic. And he says, "Get me a bougie." He actually says, "Get me a bougie." I remember when I first heard doctors say, "Get me a bougie." I was like, what are they talking about? But it's something that used to help intubate people. The way Dr. Ron's just shouting out orders here, get him 2 units of FFP. That's exactly how it is. That's a very realistic order that would happen in the hospital. Serena then says here, doctors are weird. On one hand, they're babies, they're cocky, they're rude and petty. But when push comes to shove, they can save a life. Sometimes. It's true. This episode is very doctor focused, which I don't mind. I thought it was funny seeing Dr. Ron, Dr. Bruce interact, but I thought that was funny. When push comes to shove, they can save a life. Sometimes. Same can be said about nurses sometimes. And to show how petty doctors are, Dr. Bruce here bought all the nutrageous bars within the 6-mile radius. And I don't know if doctors are that petty. If you know doctors to be that petty, let me know. That's pretty petty, pretty funny. Dr. Ron loves those bars. And here's Matt. First of all, this is so unrealistic. In no world do we do CPR on you, you're intubated, and then you get discharged like this in the same few hours. In no way does that happen. But here's Matt still chasing that gratitude. He picks up the jacket that was dropped and gives it back to the patient, looking for some gratitude. Matt's going off here. It's like, hey, it's called manners. Say thank you. I like what the guy says here. He says, I didn't realize it was a side character of my life. I got so distracted by my death and subsequent resurrection. I'm going to make sure the next time I'm hovering over my dead body, I'm going to say, don't forget to thank that male nurse. I thought that was funny. So what'd you all think? What'd you all think of this episode? I thought the episode was okay. It tackled a few things like firing other people, but front and foremost, it just talks about how thankless our profession was. So I thought that was pretty good. I also talked about when push comes to shove, how doctors get down to business even though they're being petty, which I kind of agree with actually. When during codes, and that code scene was so realistic, during codes, when everything is working together, even with people that you probably don't talk to or some doctors you don't talk to, whenever it's doing their job in perfect unison, it's art. And it's probably one of my favorite parts in the ER. When you're doing RSI, when you're intubating, when everything is going, I wouldn't say going right, but there's situation and we're handling it. Patient's crashing and we're handling it. Not everyone has to get along all the time, but you have to know how to do your job well. And I think this episode does a good job of showing that. What you all think of this episode? Let me know. Should I do more breakdowns? I did do a breakdown of episode 1. I'm going to link it here. I also did an episode of the Filipino Mafia. I'm going to link it here. So if you haven't already, please like this video. Please subscribe. And as always, don't forget to thank that male nurse.